I'm Dr. Oluwole Oluwaniyi. I'm a medical doctor and a public health specialist. In 2019, I got the opportunity to travel to the United Kingdom for my master's degree through the Commonwealth Shared Scholarship. I was excited because it was a new experience for me, and to network, to learn, and to benefit from the rich excellence of the United Kingdom institution, and to be influenced by the Commonwealth Commission. I really enjoyed the lectures, which were very interactive, and it was an opportunity for me to meet people from all continents in Edinburgh environment that is rich in diverse culture and excellence. It was very fine until March during COVID-19 pandemic and lockdown. I was only in the room day and night. The streets were empty. You could barely see people when you go out the street. It was at this time that I listened to BBC News one evening and I heard a story about a teenage girl that committed suicide.
Thing that as we come out of lockdown and in the coming months, we're heading for a mental health crisis.
We normally have a lot of people maybe mentioning suicide, but almost a third of our callers have been talking about suicidal plans. And we actually predict there will be a tidal wave of people who are going to need help and that the mental health services are not going to be able to cope.
In the same week, there was a similar incident of an adolescent male that killed himself just the next street closer to us. I became concerned about the mental health and general well-being of adolescents. At this time, I had started volunteering with the civil organization, the United Nations Association in Scotland, which is United Nations House, Scotland. I spoke to our executive director, Dr. Garrett. She immediately took interest in establishing a resilience process for the mental health and well-being of adolescents. And this culminated in a series of researches on adolescent mental health by a team from United Nations House, along with dozens of online meetings and interviews. Through Dr. Garrett, we were able to network with Optimist International, and this further deepens our research and plans. This culminated in a much more larger network with Youth Link Scotland, an organization known for its much program and activities with the Scottish youth in Edinburgh. The problem with adolescent mental health, as expressed by the WHO, even before the global pandemic, was a fifth of the total number of children and adolescents have mental health disorder. Half of all mental illnesses starts at the age of 14, and 2/3 of these will have been established by the age of 20. 75% of this marginalized population, people that are affected by mental health problems among adolescents, and residing in the developing countries. And suicide is the third leading cause of death among teenagers between the age of 15 and 19. This has a similar outlook to what happens here in Scotland. I was in Scotland, where one night of adolescents commit suicide and 1/6 have self-harm. Without long, we came up with a parliamentary one-pager policy document on adolescent mental health in Scotland, and we hosted an Eventbrite conference which was attended by lots of people, including adolescents, the parents, teachers, psychologists, and health workers. There was significant transfer of knowledge to the people that were present in this meeting. We also drew out strategies and important themes such as the state of mental health services in Scotland, how it's linked with the education, families, and the third sector challenges.
And they're even more overwhelmed now, and access to certain services are just even more restricted. So
establishing like a connection with young people over like Zoom and over like devices is much harder.
Further explored initiative on strategies to create a level platform where parents and guidance can actively engage in mental health discussion and connect with educational and social health institutions on issues regarding adolescent mental health. We have also developed a short manuscript that we use by parental guidance as screening tools in order to report promptly and avert worst-case mental illness in the adolescents. Our plan is to first develop an app that will amplify parental engagement on mental health discussion in Scotland. And we plan to extend this initiative and other mental health projects to developing countries with adolescents who are faced with the problem of HIV, gender-based violence, and displacement can be well supported. Thank you so much, British Council, for the opportunity to be exposed and be involved in this initiative. Look forward to an opportunity to establishing more bigger connection and bringing a lasting solution to adolescent mental health challenges around the world.